Hello, and welcome to this special edition of Reach Live. This new series that we're doing of Reach is all about leadership and resilience. Reach, which is a nonprofit working across the spectrum of healthcare, is looking at the resilience within healthcare post everything that's happened. I urge you to go visit resilience.healthcare to go find out more. My name is Reena Sooch. I am the host of Reach Live. I'm normally with you the last Friday of every month, but today, on this Easter weekend, is a special edition weekend. And it's an absolute pleasure to have a newly appointed CEO of CentraState Health Hospital System, Tom Scott. Tom, welcome and congratulations on the appointment.
Thank you. Good morning. Thank you very much.
It's great to have you here with us. Thank you for spending your time with us. Yeah, day 6, is that right?
Absolutely. Yes, it's just day 6. So putting on the new
Great.
shoes and the new role.
That's it. Yeah, kind of getting settled into both, right?
Exactly.
So Tom, be great to know. I mean, firstly, like your journey, right, to the position that you're in now. Tell us more. How did you get into healthcare, and what's been your journey to this role?
So, actually, it kind of goes back to my upbringing, actually, and to my parents. So, my father was a superintendent of schools, and that's kind of where the administrative part came from. And my mother was an RN, and hence the healthcare aspect. And I took the two professions and crossed them to get interested into healthcare administration. So, upon knowing that, that was the occupation that I wanted to pursue, I went to undergrad, and I remember the first day kind of talking with my advisor at the time, saying, what's the best coursework to move towards a healthcare administration degree? And he said, well, there's a couple different ways you could go. You could take the business route, or you could take, sort of the pre-med route. And he advised that the pre-med route was probably going to be the way to go because it would give me some experience into the clinical aspects. And he actually said to me, he goes, because someday if a doctor comes and asks you for a piece of equipment, at least maybe you have an idea of what they're talking about, as opposed to not having any idea. So I took that advice and actually did pre-med in undergrad, and then followed up and went to graduate school at Cornell for my master's in health administration. And having gone straight through school, I took the opportunity as part of our coursework in graduate school. It required us to do a internship between the first and second year of that master's program. And I had the pleasure to go out to BJC Health System in St. Louis, which was actually one of the first healthcare systems to come into fruition. And it was a great experience. I loved it. I had the opportunity to shadow the CEO to all the meetings he went to the type of issues he had to deal with, to the types of meetings that were held. So that was really excellent. And then upon graduation, I did what, a lot of the medical community does, a lot of the physicians do a fellowship. So I did an administrative fellowship at an institution that was actually based out of Wheeling, West Virginia, but also had facilities in Ohio as well. And it was a year-long fellowship, and I actually got to do the same thing again, which was really shadow the CEO to understand what was really involved with being in such a role. So both of those experiences really provided me a terrific platform for how I ultimately got to the position I'm in now. And it really set the stage over the course of my career to say, hey, these are the different disciplines that, you should get to know and refine during that period of time. So over the course of my career, I've been in planning, I've been in operations, I've been in finance. So I've really gotten all the different aspects of the organization, and I think it's served me well and been very helpful for my career.
Absolutely. So, what an interesting time to be taking the leadership role. We're hopefully, I say this, knowing that the situation around the world is very variant, but we seem to be moving forward in the pandemic. We've seen a huge surge and increase in the use of technology. Data has a whole new level of role within healthcare. And they're just some of the things. I could go on and on. So, my goodness, what keeps you awake at night?
Ah, well, there's definitely been a lot going on, a lot of things to keep us up at night. Fortunately, as you said, COVID was that thing that was overriding everything else. Knock on wood, that has somewhat subsided. We actually had our first time in 2 years about 2 weeks ago where we got down to zero, and that was the first time we'd been at zero in 2 years. So that was a big celebration that we had here. But what has grown to keep me up late at night, and partly an outgrowth of this, although it did exist prior to that, is really around the workforce, the staffing shortages, and what's been termed the Great Resignation that's going on throughout the country. It's not isolated to our industry. But nonetheless, our industry is a little bit different in that we have to have those resources in order to deliver the care and the health care that's needed, for our community members seeking it. So that staffing becomes a challenge. So we have had to resort to a lot of agency use to be able to backfill some of those holes. And it has really been a challenge. Number one, just securing those individuals because there is such a shortage out there. But number two, it became an expensive proposition. The agencies are quite a bit more expensive than obviously our own hiring, so that's been a challenge that we've had to deal with and kind of working through it. Some of the other financial challenges that we did, obviously during COVID, a lot of folks were reluctant to come to the hospital and they were preferring to stay home. So that obviously created a financial and a revenue stream strain for us because they were not seeking that care. And what ultimately happened was, the government, CMS, Center for Medicare and Medicaid Services, actually, in essence, kind of gave us a loan and floated us some money to keep us up. And what we're doing now is we're in the process of paying that back, which should run through probably about October this year. So, between the increased staffing expense and that shortage on the revenue side, it really put a squeeze on the bottom line. But through all this, the other thing that's kept us up a little bit is now add on top of that the supply chain issues that we've been struggling with. So, obviously, during COVID and during the pandemic, certain things were in scarce supply, and we actually were pretty fortunate. We never got to the point where we actually ran out of anything. We got extremely close a couple of times, but kudos to our materials management department who were able to just find stuff. And I need to tell you, it was great too to see the community kick in. They helped provide a lot of supplies that were crucial during that time and very helpful. But even now, we continue to see those supply chain issues, right? I can tell you from a construction standpoint, projects that we're doing and working on, we are now, when we go out to bid for a project, the construction companies are coming back and saying, okay, this bid's good for 3 days. If not, it's likely going to be an increase. So between the inflation and between some of the supply chain hiccups, sometimes everything's not coming as fast as it used to, and obviously it's more expensive. So those have really been the challenges that we've been looking at. And the reason that's so challenging is, one of our main objectives is really to improve access for the members of our community for our services. So all of these have been a challenge to that access, and that is, definitely one of the things that's been keeping me up at night.
Yeah. Oof, it's not enviable, when you really think about the challenges of running and, to aid the community on health, which is of paramount importance, right? It's life and death. And you really think about the infrastructure and all these things, and the workforce piece is particularly so interesting, that we have such an issue with keeping our healthcare workforce in place, and whether we even keep them in place, keeping them well. There's been so much spoken about in the media, and it's something that Reach have also been advocating for, is this better need for clinician support in this resilience moment. So when we talk about burnout, clinicians, taking the brunt of everything that's been happening, what has that meant for you, within what you're seeing, and what is it that you're thinking about when you think about your workforce?
It's a great question. Well, I'll start off by saying, listen, our greatest resource here is our people. and that workforce. So we've made it a priority to try to find ways to help that workforce, to help them be as best they can as well, keeping them healthy through wellness programs, and also providing support that we need to do to be able to do that. And so, look, the clinical burnout, we recognize it, and we know the importance of building on that resilience. And particularly during these times, we've tried to tackle it in a number of different ways. And let me provide a couple of examples of how we've done that. So the biggest component of ours in healthcare, like many, is really the nursing folks. And to us, that's about 75% of our workforce is nursing. So one of the things that we've done is we've hired what we call a nursing workforce coordinator. And that individual main responsibility is just to focus on recruitment and retention of the nurses. And that's ultimately going to have a huge impact, I think, on our turnover rates in a very positive way. So that workforce coordinator works with the people day in, day out, listens to what their issues are, brings that back to administration so that we can make various changes to hopefully take away some of those obstacles and make the environment much more conducive for our employees. So I think that's going to be a big addition to it. Another thing that we participate in what we call nursing Swartz rounds. This is where we offer the nursing staff a regularly scheduled time during their fast-paced work where they can openly and honestly address any either emotional or social needs that they may be facing, any caregiving that needs to occur for whether it's just for the patients or maybe even for their families back home, whether it's children or their elderly adults. Sometimes some of our individuals are squeezed from both ends in terms of all those requirements that they see. So again, another offering where we try to help them through those times to provide that support that's needed. We've also now instituted some monthly resiliency webinars. We started those actually in February, and that was in collaboration with the New Jersey Mental Health Association through a grant that helped make that resource available to us. So we continue to offer those and helping to do that. We also have a specific department here called our Health Awareness Center. And our health awareness staff periodically go up to the nursing units and will take 5-minute wellness breaks with staff. They'll do Reiki, and also some of that was offered during the big COVID surges that we had for staff, really just to give them that moment of getting out of where they were at and just trying to kind of reset as best we could. Never easy, but obviously trying to offer the best that we could to try to just to give them a little bit of that mental rest that's so needed. We also have an employee engagement committee where they've started to recognize and rejuvenate staff morale, and that's beginning to show a lot of promise. And again, geared at the same things that we talked about before. Doing a little bit of a flashback, we actually have started a book club just this month, and the latest one that we're looking at is called The Gift of Imperfection. And it's held for 2 weeks. And really the goal is just to engage staff in self-care. Let them understand, let them have an open dialogue about it in kind of a non-judgmental way. And it's completely voluntary. So those that would like to are able to attend. So it provides that other outlet as well. And then finally, we're looking at a various number of rejuvenation events. We actually have one planned for next month, which is at a nearby day camp, where all of our team members are invited to reconnect. And we think this is going to be so important. There's going to be food, drinks, music. Because of COVID, we have not really had that opportunity to be able to renew some of those relationships. So we're hoping that this is going to be a well-attended event that helps people get back out there and able to reconnect with a lot of their friends around the organization in a more of a social setting, unlike what we've been accustomed to in the past 2 years, where it basically was come to work, do your work, and then go back home in isolation. So we think that hopefully that's going to have a big impact as well. But those are some of the ways that we're trying to deal with the burnout and create more resilience.
Thank you, Tom. Yeah, lots of wonderful examples actually, and just useful for people to see, what kind of thinking is going into it. And I couldn't agree more with the get back together aspect of it. Across all industries, I feel that spontaneity of meeting and those conversations and beyond the purpose of a call, but actually just spontaneously talking can be such a huge lift for individuals and just spending time together. You spoke of access as the core thing, right? You want to drive better access into the hospital. And I think, the way CentraState began is a fascinating story in itself, right? Built by the community. So no wonder access is so important. Why don't you give a snippet to those listening about how CentraState began?
Absolutely. Yeah, no, it's actually a great story. It's actually, probably a movie could be built around it. So, going back we'll go back 60 years ago at this point, the community came together and kind of said, listen, to access healthcare, it was too far at the time. Where we were, it was largely farmland at that time. And people felt, I think the closest place was like a half an hour away. And great, in some parts of the country, that may seem like a little amount, but here in New Jersey, that actually was a long way. So the community rallied together and began doing a lot of fundraising. And actually, the first charity ball was held 60 years ago. And we actually are having an event coming up soon where we're going to celebrate both that, which is our 60-year anniversary. And then during that 10 years, they did a lot of grassroots type of fundraising. They literally went house to house. We've also heard stories that literally they had a tarp just out on the land and cars would go by and throw change and money onto that tarp. That was the kind of fundraising that they were doing. And through all of that fundraising, ultimately, 50 years ago, we opened up the hospital for operation, and it's continued to grow since that time. But we don't lose track of our roots, which was really getting a hospital built from the ground up and what had been, farmland. So right there is where the access started, and we continue to strive to improve access in any way that we can. And recently, fast forwarding now, we're looking at different ways to be able to do that. So one of the ways that we're doing is we're working on what we call a physician development plan, and we're looking to add upwards of 80 physicians, which are both primary care and specialist, over these next couple of years. And how we arrived at that, we did a study. We looked at those that were retiring. We looked those that were in the market. We looked where we had gaps, and we put together this plan to identify and recruit to fill all of those gaps. Because for us, all of those physicians really act as an access point for the community. And if we don't have enough access points, we know that that's going to be limiting, and that's going to cause other issues. If people aren't able to get the access that they need, then they will end up probably, unfortunately, coming into the emergency room as a train wreck. And then we've got a lot of work to do to be able to get them back to health. We'd much rather do it in a preventative way and be able to get to them earlier on so that we can prevent some of that from happening. And in essence, as ironic as it may sound, keep them out of the hospital. So that's one way that we're trying to improve the access. Another way, we're looking to do some physical structures. We refer to them as pavilions. They typically are let's say a 10,000 square foot type of building where we will house urgent care, primary care, some specialist timeshare, physical therapy, a lab draw station, and looking to put those in strategic points within our market. So a lot of towns, we analyze where's a good location, and we're looking to establish those pavilions. We've gotten a couple now. We're looking to expand that even more. That will help with the access as well. We have also recently expanded our network of urgent care centers from 3 to 7, and that was through our partnership with Atlantic Health System. And those urgent care centers really act as a front door to our hospital. It really no longer is the emergency department. And that's where I think some of the philosophy is changing. We always used to think, well, everybody will seek their care at the hospital. Well, COVID definitely turned that on its head. And what we're looking now is trying to bring that care out where it's more accessible to people out into the community. And granted, look, if it's a specific complex tertiary type of care, clearly that will still come to the hospital. But a lot of the other kind of bread and butter care and basics can be delivered out into the community. And that's what we're looking to try to do as well to help increase that access.
Brilliant. Yeah. Meet people where they are, you know?
Absolutely.
Yeah. It makes sense. It absolutely makes sense. Let's talk about the digital transformation that's happening. You must have seen, I mean, there's a lot happening right now. You and your role prior as Chief Operating Officer, of course, would have been heavily involved. So you have a strong understanding of what's happening. But how have CentraState coped with digital transformation?
Well, I will tell you, you look at a couple of things, and in some ways, COVID was not a good thing. In other ways, it really was a good thing. And I think on the digital front, COVID really helped kind of push us forward into that. So, as I had mentioned earlier, with people not really willing to come to the hospital for that care because they weren't quite sure what COVID was all about, we were forced to really get into more of a telemedicine type of phase in terms of moving that out there. And we were hit pretty early and pretty hard by COVID. In fact, we had the second case in New Jersey here at CentraState. So that telemedicine really kind of helped move us along that way and helped grant that access that we were talking about as well. We got it set up, we got the technology in place, but there were still some limitations. Obviously, some people are more savvy than others at that telemedicine, so we did have certain challenges, but we worked through it to figure out ways to be able to kind of leverage that. And as you talked about before, the access to data. Data is extremely important and was extremely important here. We were sort of learning on the fly when COVID was here. So data gathering and data interpretation and mining of that data was crucial to us understanding what was happening. We also used it as a way to figure out where do we go? Where are those pockets that really are needing our biggest assistance? So we have leveraged that to the extent that we were able to make sure that we could get the best outcome we could, and as we've said, increase that access through the use of technology.
Yeah, telehealth is such an interesting one, I feel. It's varied, the use of telehealth. For instance, in the UK, the National Health Service, we had huge issues with doctors understanding what platform to use. And actually, they would veer towards using a telephone call over actually doing a video call more often than not, because it was about speed, especially in primary care. But we saw aspects of that in specialty care too. We also know there's a huge policy moment right now for the USA, really, in terms of us understanding how the reimbursement structure will work. And I really do hope, and there's lots of efforts happening by the American Telemed Association and others to really drive the policy and keep it moving, because as you say, telehealth does open up options for better access, but it's not to say it's perfect. Patients and clinicians alike have had lots to say about its use. And I think it's about defining when to use it. It's not appropriate for everything, but it's certainly appropriate for many things. So where's that? What's the conversation? I'm just intrigued to know around telehealth, and what are you hearing from clinicians?
So, it's interesting, initially there was a little bit of resistance, but that's like any change, right? People are kind of a little reluctant at first. But I think from a lot of the physicians and what we hear about now, it's actually helped make them even a little more productive, right? They're able to do it from there. They're able to shift gears really fast. So it definitely, I think, has expedited the number of people they're able to get to. And that obviously helps with access. It helps with that. And, in some degrees, it's more convenient as well for the patient. You know what? They're not there sitting in the waiting room waiting for the doctor to come see them. Because, you hear horror stories sometimes about wait times. Here, they can be at home doing whatever they want to be doing. And then when the doctor's ready, boom, you just start that conversation. So I think it's a lot more amenable for the patients as well. Definitely user friendly from that standpoint. You don't have a lot of wasted time. So that's clearly, I think, some of the advantages that it brings to the table. And look, even in critical care, it plays a role. Happened to be, and it played out extremely well. Right before COVID, we actually started to install, it was kind of a telemedicine tool that we did within our ICU. So in the critical care unit, when we have these patients sometimes that are in not good condition and then something's to go wrong, all of a sudden then we're calling for the physician, we're waiting for them to arrive. Well, we leveraged some telemedicine in that point through this system that we purchased, where literally there's a button on the wall that the critical care nurses, upon something going wrong or even just wanting some reassurance, they go up, they hit that button, and within seconds, there's a physician on the screen with great resolution that's able to listen, help guide that nurse through whatever's occurring at that exact time, and actually help put forward a good plan of care for that patient. And it also helps bridge the gap up until the time that a physical physician can actually be there on site to be able to do it. So we've found that use of technology to be extremely important, and particularly in that setting where, look, time means a lot. Whether it's muscle, brain, or anything, it's extremely important with the timeliness. So we've found that to be a very useful tool in that setting.
I love that example. It's just so makes so much sense, right? Because every second counts in that scenario. So to have implemented that, and no doubt you must see, I'm sure lives have been saved through it,
Absolutely.
And that's the other thing that's a huge challenge for digital health today. It's the evidence. And in your position, for sure, ROI comes up. If we spend this much, what's the return on investment? How are we going to measure its success? And the other thing is, often for digital health providers, for tech companies, they have to make their tech pretty bespoke per health system they go to. And therefore, kind of finding a really strong value story that's scalable can be a challenge. So I think it'd just be really interesting for listeners, many who are tech companies, to know, how do you currently measure outcomes for such systems that you've implemented?
So we always start with what we call kind of a business plan in the simplest form. And what we identify are what are our assumptions going forward about what we're going to be implementing, whether it's a new piece of equipment, whether it's a new program, whether we're looking to add staff to do something different. All of those aspects get in there and get looked at. And then we put together that plan. And again, it is just that. It's based on those assumptions. But then what we look at is we're looking for a certain return because we do have limited resources. So obviously with a bunch of business plans, we kind of set criteria about what's got that highest probability for success. And those tend to get pushed up on the priority list and are done first. Post implementation, we take that same rigor in terms of looking at how well is that program doing to plan. So were we on target with those assumptions? Is it living up to what we thought it would be? And then obviously, as you mentioned, now are the outcomes, right? And what do we measure? So for us, we really try to stick kind of what I call the basics. And the three basics are delivering superior quality outcomes, enhancing the patient experience, and doing it in a cost-effective and efficient manner. And if we do those three things well, we are going to be well served with whatever comes down the road or whatever issue kind of faces us. And that's those things that we look at. And we measure those against industry benchmarks that are now becoming much more readily available. And so whether we're talking on a quality basis, patient satisfaction, or cost, we have that benchmark to compare to. And that helps us gauge, hey, are we successful relative to others that have tried this? And for us, that's been a real good recipe for us to be able to be successful, is to employ those.
Fantastic. Thank you. I mean, we could go on for longer. I still have many questions, but we are at time, which has gone so quick. Tom, thank you so much for spending time with us. Wishing, especially on an Easter weekend. So we do, very grateful for that. And we wish you and the listeners a very happy Easter this weekend. And yeah, just thank you so much for spending your time with us and for being here. Any final comments from you, Tom?
No, I just appreciate the opportunity. This has been great, and glad we could share what we've been doing here and found to be successful.
Fabulous. And for those listening, there's going to be a Leadership in Medicine event happening April 27th in Princeton. So if you are local to the area and you want to know more, get in touch with Reach directly and they will tell you the information. But for now, thank you so much for joining us on this special edition. Wishing you a wonderful Easter, and we will see you soon on Reach Live.